clear. Sure you do.
Hello, happy Monday. Today was a very long day. It was only 10 to 4, but it actually ended up being 10 to a little bit past 5, and then also the drive to the clinic is almost an hour long and then almost an hour back. All in all, the day is basically from like 9 to like 6:30. I had an awesome day though. I've been told that rotations like just keep getting better and better, and like whenever I talk to people about their rotations, I feel like I hear so many positive things about each rotation that it makes me so excited for the future, which is crazy because like to me, the last rotation that I had, I was already so happy for the 6 weeks, and it was outpatient IM, and it's not really something that I'm interested in, but I still had such a good time. And now I'm in inpatient IM, which is still not something I'm really interested in, but I'm having an even better time. So I just feel like with each rotation so far, and like I've only had 2, so you know I can't really judge, but it's just been so great, and I'm very grateful and I feel very lucky. And also the thing that makes this rotation just so special for me is that 2 out of the 5 days of the week we are in cardio clinic, so all the patients are cardio patients. I just feel so like at home. I don't know, without sounding like a nerd, I'm just like, it's so enjoyable to be in cardio clinic and talk to cardio patients, because obviously I'm very interested in the heart, so anything that has to do with the pathologies and diseases of the heart, any like comorbidities, even medications that are related to like heart failure or anything like that, I just find super interesting. So yeah, 2 out of the 5 days are that, which is perfect for me. And then the 3rd day is cardiac procedures. That's even better because it's cardio plus procedures. And I feel like I learned so much today. I heard a split S2, so I heard an ASD, I've never heard that before. I heard an arteriovenous fistula in the groin, which I've never even listened to the femoral artery before, so this was the first time doing that, and I heard a murmur. And I heard a mechanical mitral valve. Just things that I like, it always like blows my mind, the things that I've never heard before, and then hearing it for the first time. The attendings are awesome. The staff is so friendly, so welcoming, so awesome. Like everybody's so fun. I've learned so much today. I got a little notebook from Alex that I like wrote so many notes into, so I'm just, it's crazy how much you learn during the day. I don't know how to describe it. Like I feel like I'm like talking so much just because the day was so good and how I'm so happy today. Anyway, this definitely gets me very excited for the rest of the rotation. I am gonna head to the gym now, and I barely studied today, so it's going to be very interesting to see how I adjust to studying during this rotation, because last rotation I had plenty of time to study after and even while I was on rotation. Today the schedule was really filled, so there's definitely no time to study during. It is tiring, so we'll see how I do with studying after. First day in the hospital today. It's so nice to be back in the hospital setting, first of all. Second, we rounded on about 16 patients today. It maybe took us around 5 hours, and it was really interesting. A lot of medications that I have to review, like what bugs, what presentation, and what's the best kind of management. So I'm gonna go home and review that. All in all, it was very interesting, and I feel like I learned a lot, and also grateful that we got let out. It's like 2:30, so we got let out early, and we don't have to come in tomorrow, so a full day to study tomorrow.
Pneumatosis and advanced severe disease.
Today is Friday, and I'm very fortunate because I got the day off today, which means that I have a long weekend, and I have exciting weekend plans with my friends, so today has to be a very productive day because there's a lot of things that I left behind. Since I was given this day off, I need to make the most of it so then I can have fun separately on the weekend without worrying about school. I have a couple of chores that I have to do today, like groceries, dropping off packages, and also just generally updating my calendar, looking at the future meetings and all the stuff that I have coming up. And I'm sure I'll find more things that I still have to do as I go through it. It's beautiful. It's 10 in the morning, so it's like still cool. It's sunny. I'm gonna get in a light workout and hopefully finish like a third of the cards that I have for today. Like I was saying this morning, I had the day off and I was thankfully able to capitalize pretty well on having the whole day to myself. I went through all my emails this morning, did a couple of the chores that I planned to do, had my nice little walk, did my Anki, did about like 200 cards while I was walking around, did some more Anki. I'm working through that like 700 hole of Anki cards that I'm in right now. And one of the big things that I also wanted to do today was review, because I do my UWorld questions every day and I do the Anki cards associated with it, plus all the reviews that I have that come back every single day. But one of the things that I also try to fit into my weeks is content review, and usually I do that by watching videos. And of course, as you guys know, the thing that I always talk about and the thing that I use the most is Sketchy. So since I always talk about it, I wanted to show you guys how I use it and what it looks like in general if you guys haven't seen it before. So my first and second year, I used it for Pharm, Micro, Biochem, and Path, which is all included in the subscription, but now also in the subscription is Sketchy Clinical, which is for your third and fourth year rotations. So if we go into Sketchy and look at what I've been doing so far, these are all the lessons that I've started and I can continue. So it's like tracking my progress throughout each. Sometimes when I go to the hospital and there's like one thing that they mention, like we were talking about patients with myeloproliferative disorders, there were a lot of things that I couldn't remember. So when I got home yesterday, I was watching this bone marrow failure Sketchy. So this is what the front page looks like. So these are the lessons that I have already started, and then these are all the courses. These bottom ones are the clinical part of Sketchy for third and fourth year. So if we look into internal medicine, because I'm in internal medicine right now, there is a ton of lessons. And I just love the way the main page looks because it is just so fun and colorful, and it makes me want to click in and watch every single video. Like, it's just so entertaining. There's all the different systems that are covered in internal medicine, and a little bit of extra things like the Sketchy pearls were really great. I reviewed it in the beginning and it just gave a rundown of like how to read a chest x-ray. Rheumatology is one of the new lessons that they have just recently added, which is really cool. So they're constantly expanding, constantly adding new things, and constantly making it better. There's so many new features that have also been added recently that are so useful. So this is what it looks like when you click into a specific system. It then breaks it down for you into different categories and the videos associated with those categories. So approaching clinical conditions, differential diagnoses, it literally walks you through the presentations and then how to put it all together, how to come up with a list of differentials, and how the presentation differs for each one slightly. It's very good. So a little bit of everything. So when we click into the video, there's a couple of different things here. So we go ahead and start the lesson. And then this is the video part. That's the first thing that comes up.
The differential diagnosis of polyarticular joint pain in adults.
And this is like classic Sketchy. You have the sketch that gets drawn in. You have all the symbols that are associated with the sketch. You have jokes that are in the videos that I always love that keep me engaged throughout the whole thing. And it's really cool because, as you can tell, the video is still going. And so you can follow along with just the symbols, or you can follow along with the video. So however you want to view it, they made it accessible in any way. And then when we keep going, the next thing that they added are questions. So this is a great way to make sure that the video that you just watched, you understood, that you remember. This is active recall. This is exactly the way you should be approaching learning new concepts in medical school. Another thing that I wanted to show that they have, and I'm gonna look at this video specifically, is some of the videos have multiple components to them. And so as you can see, it'll actually walk you through through the overview, the risk factors, presentation, physical exam, diagnosis, management, clinical highlights, and then you get to this amazing little thing called the cram card, where they will basically summarize everything into one little card. So these are the most important things that you have to know about the video that they're showing. So there are 181 new videos and 59 revised videos and lessons that they now have for Sketchy Clinical, which is so cool. And I've been such a huge Sketchy proponent the first and second years, so it's really great for me to be able to keep something like this consistent, because once you get used to a study tool and you know that it's working really well for you, which it has so far, it's good to be able to just keep it going. So I'm very excited to be using it all throughout this year. My aim is to keep up with each section and each rotation as I go through it, and hopefully be 100% done with all the videos and all the questions and resources that they have available. The other amazing thing that Sketchy also added and took care of is now they have an app. So if you download the Sketchy Medical app and you have the subscription to Sketchy as is, the app is free, and all the resources that you can access online on the website are now on your phone. Look up any video, watch it on the go while you're like taking the train to your rotations or something. Or a feature that I really like is you can quickly look up the term that you're looking for, like mitral regurgitation, and if you're trying to remember something or trying to learn more about it after you heard about it in the hospital, it'll take out the associated videos with what you looked up, and you can basically go ahead and watch that video and get a quick little recap on what you're trying to remember. I love how Sketchy is consistently improving things, listening to feedback, and making all these resources more accessible. This is a resource that I have genuinely sworn by the first 2 years of school, and I still continue to use. And if you ask me to recommend one thing, this would be it. So I hope this can help you guys as well. And I am gonna go review some hemonc videos now, because I'm in hospital now and there is a lot of oncology and cancer patients, and that's definitely one thing I have to brush up on. So there are 16 lessons. Let's see if I can get through all of them. It is 7 p.m. on a Monday. I was at my cardio clinic and I got there at 9 and I was done at 6. So it was a really long day, longer than they usually are. But I learned so much in there, and I write so much stuff down in my little notebook, and I feel like I leave the day with so much more information than what I started with. And I'm seeing so many different pathologies, and I'm getting to look at all these different EKGs and coronary angios and other perfusion studies, and I'm seeing so many different patients. It's really interesting, it's really cool. My attendings are awesome, they're so willing to teach. But today was such a long day and I'm really tired, and I have a meeting in 5 minutes, and then I really have to catch up on so much studying that I didn't do over this weekend. But I had such a fun weekend, so no regrets, but I just have so much catching up to do. Also, my attending challenged me to a game of pickleball and or tennis, and I told him that in that case we should just play like a set of each. He's convinced that he's gonna win because he's been playing a lot of pickleball and tennis, so we'll see. I haven't played tennis in I don't know how long, and I played pickleball maybe like 2 weeks ago. That might happen this week. Done for the day. It's 4 p.m. Today was really interesting. Technically today we should be at the hospital, but they give us the option to come in and see the arteriovenous clinic, where they can fix varicose and bulging veins, and they can fix plaques in arteries. So I thought today was going to be a venous day, but it was actually an arterial day. So I watched about 5 patients get the plaques in their arteries fixed up, and this is specifically in the lower extremity. So I thought it was really interesting because usually when you think of plaques in the coronary arteries, they will put in stents, and then if there's multiple vessels or it's really severe or for some reason they can't put in a stent, they will do a bypass which would be open heart surgery. But in terms of lower extremities, I asked, and they apparently try to avoid stents. So the first thing that they're going to do is they're going to try and break up the plaque, and there's a couple of different devices that they use. They were either kind of like screw through the plaque and like suck it up and collect it, or they will use this other device that basically like pulverizes the plaque into very tiny particles, and after they break up the plaque, they actually go in with a balloon and then open and the artery and push the plaque to the sides, and with that they open it, and then they deflate the balloon and take it out, and the plaque will kind of stay on the sides of the vessel, like the remaining plaque, so they don't stent it. And the reason that they said for that is because stents in the lower extremities tend to close up pretty fast and often, so they said that they actually prefer to just do the balloon, and if the artery starts to close up again, then they can just go back in with a balloon again. And I think they said this can happen like every 6 months or so. So yeah, I learned a lot about the anatomy, all the way from the descending aorta, the iliacs, and all the way down through the leg. They use contrast and live x-rays, so for an hour you are watching the procedure in full lead. My feet hurt. I definitely need better shoes, which I need some recommendations on what shoes to get. I really like this part of interventional cardiology, the procedural portion. I like how many different kinds of procedures they do in interventional cardiology, because this was only one type that I saw and it kept us busy the entire day. And it was interesting. So today was a fun day. I am tired and I'm gonna go home now and study.